Most cancer patients love their oncologist. They have a close relationship and they feel that they work well together. But would you still love your cancer doctor if you knew that they had conflicts of interest in prescribing chemotherapy and some of the growth hormone drugs in their offices?
Well, it's a tough situation. I mean, when a doctor is making a lot of income off the drugs that they're selling, they can amount to as much as 65% of their wages. I'd say the average oncologist probably makes 25 to 30% according to the studies that have been done. You got a conflict of interest there that makes you wonder as a patient if the doctor's really doing the most they can for you, considering who you are.
That they're getting these kickbacks.
It's enormous. There was one group in the Pacific Northwest of 6 oncologists who, for prescribing some of these growth factors to increase white cell or red cell counts, made about $2.7 million in 1 year just from the sale of that one class of drugs. You can imagine what they must have made altogether with the sale of all the chemotherapy drugs. It would have been staggering.
And if you find this difficult to believe, you do write about this in your book, A Return to Healing, and Ashley, I know that this is on page 126.
Okay.
But this is a factual thing. And, we're not trying to say that oncologists are not good people and they don't mean well and they don't want to help you.
They're human like everybody else.
Yeah. It's interesting. The government tried to reduce the profit margin from administering chemotherapy, but they just prescribe more profitable drugs.
That's what they seem to do. That's
and
right.
It's really a shame.
Well, it makes you lose confidence. And we have enough trouble with oncologists the way it is because the research that they're using is not solid research. What we're looking at is a very low grade of research. It's comparing the effects of one chemotherapy to the effects of another chemotherapy or of radiation or of surgery. We're not using the placebo controlled studies where one group you treat and the other group you don't, and you compare them. And of course, the reason they say that is because they say it's unethical, but where are you going to get solid data that you can believe?
Doctors in private practice admit that they're 9 times more likely to make more money if they administer chemotherapy drugs in their office compared to doctors that work out of a hospital.
Yeah, that's right. They're the ones who make the money. The hospital-based doctors don't make anything from it. And usually those doctors working for HMOs don't make anything from it.
Well, the hospitals do, though, I guess.
Well, the hospitals do. Somebody's going to, because pharmaceutical industry is very clever, Vicki.
Yeah.
Because what they do is they go ahead and make sure that the drugs that they have are used, and the incentives they give are tremendous. When you're looking at hundreds of thousands of dollars sometimes.
This makes me think, too, that when people do have cancer, that it's a good idea to take your time a little bit. Many times a patient feels pressured that they have to make a decision right now, like yesterday, that they need to have it taken right out, start the chemotherapy right away and all that.
Right.
But it's worth it most of the time to take a little time, take a few days, take a week, whatever.
A couple of weeks, it's okay.
Yeah, and do a little of your own research, because there really are alternatives and things that you might want to take a look at and you might want to consider. And also questions to ask your doctor. You probably want to ask your doctor how long this drug is going to extend your life. If it's going to help your quality of life. Is it going to extend your life like 1 month and then you're going to be throwing up and feeling sick and losing your hair and crawling to the bathroom because you're so tired and weak? You need to ask those questions and find out if it's worth it or not, because the other thing is that it's very expensive.
Mm-hmm. Well, chemotherapy is not fun, and it's not exactly what we all like to do. And there are alternatives that should be considered, as Vicki's saying. And some of those alternatives are very important to consider. And yet there are very, very rare doctors who are treating people who have cancer that are mainstream oncologists that look at all the complementary alternative therapies that are possible out there.
Chemotherapy is helpful for certain types of cancer.
It can be wonderful.
Know that.
It can be wonderful.
Good for non-Hodgkin's lymphoma. Sometimes it's helpful for leukemia.
That's right.
Yeah.
And sometimes for solid tumors, which are very difficult to treat. But yet you look at your stage 4 cancers, that are widely metastatic, the 5-year survival rates are in the range of about 2%. So Those people very often are being recommended cancer as a therapy, a chemotherapy as a treatment for cancer, and you have to wonder about it. I think we need to have a new breed of doctor that's interested in looking at everything that's possible rather than just what they're taught in their training, because unfortunately there's a conflict of interest of the medical schools themselves and the residency programs that follow it that are so engaged with working with big pharma that everybody just assumes that that's the only way to treat it and that's what should be done. Of course, that's the furthest thing from the truth in some cases.
We don't really have medical freedom either.
No, in this country we don't. There's no constitutional provision that gives us medical freedom.
Because in Western medicine, the only ways we're supposed to legally treat cancer is surgery, chemotherapy, and
Oh,
radiation.
in California, it's a felony if you do it any other way. So what we have to do is either send patients out of California to places where they can do it, or treat the immune system to try and boost it so that it'll do something to try and fight back in terms of what the cancer is doing. So we've got a problem, and unless we do something to change the way that we look at how the whole business, the cancer business, and I say it that way, the cancer business is handled, and make it more of a service with open disclosure so things are transparent, it's going to be difficult to treat.
It's good for people to all be aware of this. In case this happens to you or a loved one, you need to be prepared.
Right. So you do your homework on the internet, you see your oncologist, and you also look for complementary alternative approaches that might just be the right thing for you.